Shalom everyone, I am Shakina the Neuro Disruptor and I'm back again with another video. Thank you so much for tuning into my channel. I plead the blood and love of Jesus over you as you listen into this video today. If you like what you hear, please give this video a thumbs up and share it among your networks. If you haven't already, please click the bell icon down below and subscribe to my channel so you can stay up to date with my videos. I post regularly about politics, policy, and prophecy. If you feel so inclined as to leave a comment down below, please, I invite you to contribute to the conversation, but please make sure to leave your comments productive and respectful. The reason why I'm doing this video is because I wanted to record a response to a recent video that was posted on Dr. Scott Jensen's Facebook page. For those who are unfamiliar, Dr. Scott Jensen is an American politician. He served in District 47 in the Western Twin Cities in Minnesota State as senator. He is a practicing medical doctor, and he is a very fierce and successful healthcare and patient care advocate. He recently posted a video talking about how he is now under a third probe by the Board of Medical Practice because they received anonymous allegations claiming that he was downplaying the effects of COVID-19 and some of the commentaries that he made in his news interviews and within the political arena. There are a number of reasons why I found this situation so disturbing. First of all, when I went to do a background search on Dr. Scott Jensen and the work that he's done and the commentaries that he made about the government's response to this pandemic, I found no evidence that he was downplaying the effects of COVID-19. Nor did I find any evidence that he would be the type of person that would do something so irresponsible as to downplay the effects of a global health crisis such as the one that we're in right now. In fact, it seemed to me like quite the opposite. It seemed to me that he was trying to draw attention to how the government is downplaying the secondary and tertiary consequences of COVID-19 by funneling most, if not all, of our resources now into curbing the spread of this pandemic, of the virus, and maintaining these lockdowns while completely ignoring other underlying social, health, and political issues that existed before the pandemic that were already burdening the system, that have now exacerbated their burden on the system because they're being almost entirely neglected by the government in favor of responding to COVID-19. Now, one example of that would be that in 2019, there was 71,000 opioid-related deaths in the United States, okay? Now, in 2020, after the pandemic hit, they recorded 87,000 deaths in the United States related to the opioid crisis, which is a 27% jump from 2019. He's trying to draw the light at how these systemic deficiencies could actually be contributing more to our inability to effectively respond to this pandemic than individual behaviors such as staying home, okay, and not attending church services or, not attending work or shutting down small businesses. This is what he's trying to bring to light. So he's trying to show that this issue is a lot more complicated than the government is making it seem. I don't see that in any way as downplaying the effects of COVID-19. In fact, he's trying to show how serious COVID-19 really is and how much of, the issues that it's causing, how much of these issues are being ignored, okay? The second reason why I found this so disturbing is that whoever it was that made these allegations, they attempted to weaponize a regulatory body against a physician who was making a public opinion on a healthcare response in the political arena. Are we just throwing our ethics out the door now? Regulatory bodies are designed to protect the rights of patients and ensure that they're receiving the highest quality care with dignity. Okay, that's what they're there for. They're there to ensure that the standards of medical practice are being adhered to. They're not there at all to be involved in the political arena and silence people in the political arena. That's not what they're being used for. So whoever made these allegations was trying to weaponize Dr. Scott Jensen's patients against him. They were trying to use his patients as human shields. If that is not unsettling to you, I really don't know what that is. And this should be going viral. Everybody should be talking about this. It's quite disturbing that they've now come this close into our territory where they're weaponizing our own healthcare against us in order to silence people and gain a political advantage. Okay? The other thing is that there was a lot of truth in what he was saying. And then now, we're silencing truth, and we're trying to use regulatory bodies to do that, to silence people who are trying to speak the truth and trying to shed light on the truth. The fact that somebody could be threatened, the fact that people think that someone should be subjected to disciplinary action because he's speaking truth, that's a new level of low. That's disgusting. And we should all be outraged at that. Okay? We should all be outraged. Now, I want to tell you something right now. There is a war on information happening right now, and I would argue that this is probably the biggest global health, global social issue, globally, political issue globally that we are facing in our era. Okay? This war on information has now created this very polarizing mainstream narrative where you're either pro something or you're anti something. And if your perspectives, if your analysis of reality, or if your own reality does not fit within this very polarizing, rigidly defined narrative, then you are subjected to the new brutality which is called cancel culture. You are automatically canceled out. And not only are you canceled out, you're threatened with disciplinary action like Dr. Scott Jensen. Yes, the Board of Medical Practice found that these allegations were unfounded, that there was no evidence to support them. But still, what do you think it's doing to him mentally and emotionally to have to receive a letter like this for the third time? Because he's advocating for his patients in the political arena, and which as a politician and physician, he's obligated to do. So now we're trying to punish a doctor for fulfilling his obligations? For adhering to his oath? Really? I mean, this is unacceptable. So now if you try to shed light on the complexities, or you come in and you ask the tough questions, this is what happens now. And we need to ask why. This war on information has predominantly given advantage to the radical left and the folks that are upholding the NGO industrial complex and the Poverty Inc. folks. These are the people who want human disease and human ignorance and human suffering to thrive. Why? Because then they can justify funneling millions of government dollars, and they can justify asking private sector donors for millions of dollars, okay, to fund their initiatives where they now claim that they're solving these problems. Like how the United Nations is claiming to be taking a lead in responding to this pandemic. So they have a chokehold on the information distribution channels, and they also have a chokehold on society's psyche because they've created this ethical framework which they are coercing everybody to adhere to, even though it's not aligned with reality. This is disturbing because what this means is that they will lie to you and pretend that what they're doing is the right thing to do to curb this pandemic, or to prevent this pandemic, or to prevent this pandemic from getting worse, right? Or to actually bring an end to this pandemic, and none of that is true. None of that is true. And so we need to start questioning deeper. Yes, it's hard. It's hard to think for yourself, and it's hard to question things, but we are obligated to, for ourselves and for our loved ones. We are obligated to ask the tougher questions, to think deeper, okay, and to support People who are asking the tougher questions and holding people accountable. I want to draw your attention to the first people to downplay the effects of COVID-19. Number one, the government of China. Okay? The government of China would be the first one to downplay the effects of COVID-19. For those who can recall, Dr. Li Wenliang was a 34-year-old Wuhan doctor. He had tried incessantly to warn his colleagues, the public, and the rest of the world about coronavirus, okay, and this imminent pandemic. Do you want to know what happened to him? The Wuhan health authorities showed up at his place in the middle of the night to probe and question as to why he was spreading rumors and releasing this information to the public. 3 days after he was visited by the health authorities, the police showed up and apprehended him. And they forced him to sign some sort of document or order admitting that his behavior was unlawful and illegal conduct. A week later, Dr. Li Wenliang died at 34 years old as a result of coronavirus. Devastating. Okay. But here's an example of a government body that had all the power and all the foresight to act on this pandemic, to act, to institute proactive measures, to heed the warning that they were given. And they chose secrecy, maintaining status quo, not spooking the public, and maintaining their political image on the international stage. They chose that. They chose that over doing the right thing and responding to this pandemic and taking heed of the warnings that they were given. So they were the first ones to downplay the effects of COVID-19. Let me draw your attention to the next group of people to downplay the effects of COVID-19, the United Nations Health Agency. On February 24th, 2020, a press conference was held in Geneva where the United Nations Secretary General stated if he still thinks it's possible to contain the disease, then they're not going to declare it a pandemic. This is after coronavirus has already killed hundreds of people in China and had already killed over 15,000 people worldwide. Okay. On March 7th, the Director General of the World Health Organization said this: "Why declare it a pandemic unless we are convinced that it's uncontrollable?" On March 11th, 2020, the World Health Organization declared that the coronavirus had now become a pandemic. Let's look at some numbers here. The virus's incubation period is anywhere from 1 to 14 days, with a median average of 5 to 6 days. The Director General of the World Health Organization on March 7th declined to declare coronavirus a global health crisis, a pandemic, because they didn't have enough evidence that it was uncontrollable. On March 11th, they declared it a pandemic, 4 days later. So those numbers indicate that we were already in the middle of a pandemic when the World Health Organization refused to declare it a pandemic. The World Health Organization describes the pandemic as a sustained community-level outbreak in at least 2 or more world regions. This pandemic had already affected countries such as the United States, Italy, China, South Korea, Iran,
and many others. So we were already long past the threshold, like long past the threshold of declaring a pandemic, when the World Health Organization, the largest government health body in the world, refused to declare it a pandemic. So who's really downplaying the effects of COVID-19? And then you have doctors like Dr. Scott Jensen who are saying, hey, the way you responded to this at the beginning of the pandemic was atrocious, and the way you're continuing to respond to this pandemic is even more atrocious and irresponsible. He's trying to say, let's stop medicalizing society and look at all the facets, which is really quite important, because he's saying shutting down the economy is causing more problems than it is good. He's very right. Socioeconomic status, that's your ability to fund your healthcare, to fund your living expenses, to fund, your social life. Your socioeconomic status is a very strong contributor and predictor of health and wellness. And so yes, it's actually very likely that the more we have people falling into poverty during this pandemic, the more likely they are to get sick with this pandemic. Because socioeconomic status, World Health Organization knows this, every government body knows this. We study this in public health, we study this in global health, we study this in nursing and medicine, every healthcare sector in the industry, we've studied it. That socioeconomic status is the strongest predictor of health outcomes. And you have a doctor saying, hey, maybe driving people deeper into the pits of poverty is not going to solve the problem. It actually might be making it worse. And he should be subjected to disciplinary measures for that. So what should the government of China, and what should happen to the government of China or the United Nations, right? Or the government now that's being completely irresponsible and reckless in their response. Now, I'm doing this video, I'm transpartisan. I'm doing this video because I myself am a Canadian health policy maker who's also done very successful policy work around the world. I worked as a nurse in long-term care for almost 7 years. So I was at the front line, and I, along many of my other colleagues, we bore the brunt of broken policies, of misinformed or even uninformed policies, and of government corruption, right? And poor management or mismanagement of healthcare resources, right? I've experienced that firsthand. I'm coming to you as a patient myself who's been severely abused by the healthcare system and who has been overly medicalized by the healthcare system while they ignored other parts of my humanity, okay? So, and I'm coming to you as an advocate, saying that we need to stand up and support physicians like Dr. Scott Jensen and Dr. Li Wenliang. May his soul rest in peace and power now. It behooves us to listen to what they have to say. These are people who went to school, who studied, who, stayed up sleepless nights, who are putting in the work to understand what their patients need and are putting so much at stake to advocate and get the truth out there. And it behooves us to listen to what they have to say and not reduce their commentaries to such pettiness as these people are trying to do, who are making these false allegations and trying to distort the truth and the reality. So that's all for today. I encourage you all to, just think about this, ask the deeper questions, and don't be afraid to challenge those in authority. Okay? We know that our Lord and Savior Jesus Christ, he did this, and we shouldn't be afraid to do this either. Okay? We're here to fight for righteousness and truth. Stay blessed.